Hello, I'm Sarah Day, Policy and Research Manager at HFMA, and you're listening to HFMA Talk, the podcast for NHS Finance. The HFMA is here to support our members, the wider finance community, and the NHS throughout the coronavirus outbreak. We recognise that people face many different challenges, and part of our role at the HFMA is to help people understand what their colleagues are dealing with, as well as supporting people to feel less isolated in their work and decision making at this time. As part of this, it is our intention to produce a range of podcasts that will hear from people working across different sectors, regions and roles. Listening to people speak about the challenges that their organisations are tackling and their personal experiences of the pandemic can be very powerful. We are all working together to beat Covid-19. We are part of a wider effort, even though we may be isolated from our teams. This episode is the first in a series of conversations that we hope to share with you with Sanjay Agrawal, an HFMA trustee and a consultant in respiratory medicine and intensive care at University Hospitals of Leicester NHS Trust. Sanjay has kindly agreed to talk to us on a weekly basis, if work allows, to document the development of COVID-19 in his trust, sharing their learning and providing a clinical insight into the pandemic. During the interview, Sanjay talks about ECMO. ECMO is a specialised therapy in intensive care where a patient's circulating blood is put through a machine that removes the carbon dioxide and puts in oxygen before returning the blood to the patient. ECMO is only done in a few centres across the UK, and Leicester is one of these. So, hello Sanjay, thank you for taking time to talk to us at what must be a very busy time for you. It's good to have you with us.
Yeah, no problem. It's good to be able to talk about how things are progressing.
So I wonder if you could start by telling us a bit more about your role and how COVID-19 is impacting your region and your organisation at the moment.
Yes, so I am a consultant respiratory physician and intensive care consultant at Glenfield Hospital in Leicester. And so my role is twofold, both within respiratory medicine and also preparing for what we think is going to be a large number of patients in our intensive care unit and the impact on the rest of the hospital. So over the last 3 weeks, I would say, since the first cases started to appear in the UK and the first people became admitted, we became very aware that it is likely that we would start seeing admissions in our intensive care unit, and that based on the experience of Italy and China, that these numbers were going to become quite overwhelming very quickly. So in our particular intensive care unit, we're commissioned for ECMO, and it also became apparent that the people that need intensive care often develop quite severe respiratory failure and may need ECMO. So our ECMO team were particularly proactive in trying to understand what was going to be needed and, in fact, prepare everybody and essentially wake everybody up to the idea that we're all going to be affected by this. So I would say probably about 3 weeks today, in fact, the noise started. And I think for everybody working in the healthcare service, the noise about COVID has obviously ratcheted up massively. But 3 weeks ago, it was still pretty quiet, relatively quiet anyway. But we started to really seriously think about it then. And so if I start with my own hospital and my own particular unit that I work in, the ITU, we started to prepare training sessions and think about how we were going to put on and off personal protective equipment so that if we were intubating a patient, we could do that safely and not put staff at risk. So about 2 weeks ago, we started rolling out training for all of our ITU staff, which is about 200 people. And pretty much by the end of last week, we had done all of our ITU staff. But then we became aware that actually other staff members across our hospital also needed training. And it's probably fair to say that because they weren't necessarily going to take the intensive care patients, they weren't quite as sort of thinking about the training of PPE. So we started to help them think about getting ready to use personal protective equipment. So I would say over the last 2 weeks, we've spent a lot of time getting people ready, thinking about how they're going to get equipment on and off. Alongside that, there's been a huge amount of work thinking about planning of equipment. So, ventilators, tubing, other consumables, how much stock we have, how much more we need, what are we going to do when we expand into theatres. So there's the equipment side of things. How do we liaise with the wards, the respiratory wards and the other wards at my particular hospital, so that we have a seamless as possible transfer of patients from the ward to the intensive care unit. We've been thinking about how we skill up our theatre staff so that when the time comes and we spill over into theatres and anaesthetic rooms, how can we maximise their skill set to help us on the intensive care unit, given that elective surgery, of course, will have been stopped. So there's been a lot of preparation with trying to skill up and cross-skill, let's say, staff from theatres to help us in ITU. In parallel to this, we've been devising rotas for consultants and doctors in training. And just like everywhere else, I'm sure, we've had a lot of people already in self-isolation because either they have symptoms or their families have symptoms. So we've had to adapt, obviously, to people all of a sudden not being at work. And so people have been covering night shifts and day shifts when people have dropped off the rota in the intensive care unit. And I have to say that pattern is also replicated amongst obviously all staff groups, nursing staff and ODPs and theatre staff. And my other department, the respiratory department, again, I would say probably 20% of the consultant staff and trainees have already had to self-isolate at some point, leaving clinics and wards and other things that needed to be covered in the interim. So there's been a huge amount of activity in terms of skilling staff, preparing for the numbers of patients that are predicted that will need us in hospital. There's also been a lot of time spent, if you like, emptying the hospital where we can. So we've now ceased pretty much any elective surgery that can be postponed, pretty much only doing emergency surgeries, and to empty our intensive care unit. And equally on the respiratory side of things, things like I'm involved with the lung cancer clinic and patients, and of course that's a time-sensitive pathway. And so we already had a triage clinic process prior to COVID, and we've had to sort of almost accelerate and expand that triage element, whereby we don't necessarily see the patients, but we do communication through the telephone and arrange appointments and minimise their hospital contact. We've also converted pretty much all of our face-to-face clinics across respiratory medicine into telephone clinics. And I have to say there's been a massive effort from our clinical admin staff contacting patients, letting them know what we're doing and why, and converting the face-to-face clinics to telephone clinics. So it's really been a huge team effort to get us this far, and it feels to me now that we're people really know what's coming or have a feel for what's coming and are doing everything they can. And I've been really impressed and gratified by patients and their responses to appointments being cancelled, and they completely get it, and they know why things are being cancelled and why they can't have the test and why they can't come to clinic. So that's been great. So we've all had to get used to different ways of working, preparing for the future, cross-skilling and working in a different way. And also, I'd say, supporting each other in terms of mental Well-being, because a lot of people understandably are very anxious, and that might be anxiety due to their own personal circumstance with their own family, kids, childcare, elderly relatives, chronic conditions, or it's been that anxiety about having to do things that they've never done before or might be expected to do, and just anxiety because their way of life has changed. So there's a lot of thought being put into how can we help staff and colleagues to cope with what's going on and as things evolve and the unknown. And so, for instance, we've set up a mentorship group within respiratory medicine so people can call specified members of staff and just talk and have a conversation really about how they're feeling.
What sort of effect are you experiencing on a personal level for this? How are you thinking about maintaining your own resilience now when you're anticipating it to come, or in the future as it develops? Yeah,
so in terms of my own personal resilience, I mean, I think I'm very lucky because all of my near ones and dear ones, if you like, in terms of family, I know are relatively independent and can look after themselves. So I've got, an older daughter who's absolutely delighted that she doesn't have to do her A-levels, and there is no sense at all that she is disappointed in any way. So I think she's quite chilled and pleased about that, in fact. And my wife is okay, and my mum, who lives on her own, but is pretty independent. My father-in-law lives on his own. So on the one hand, I would say I have a peace because I know my relatives and my family are sort of going to be as good as they can be. And then from a work standpoint, I'm feeling reassured that I've done everything that I can in my own environment to understand what I need to do, what's going to be expected of me, and as prepared as I feel I can be, given that much of what we're going to be doing is unknown. So I feel I feel reassured. So that's helped my resilience. I've controlled the things that I control, and I'm not going to worry as much about the things that I can't control because I can't control them. And all the other things, in terms of, exercise and listening to music and having friends to talk to, WhatsApp groups as well. I've got, I'm sure everybody will have had been admitted to various new WhatsApp groups. And I've got a particular group of friends from university who just send around ridiculous, funny videos and pictures and things. And that definitely keeps me ticking over.
Yeah, that sounds good. The resilience and the work that you've been doing with your staff, has that extended to all the people in the hospital? Would finance teams have been having similar sorts of discussions?
What's been really, really amazing logistically is, I think, the whole kind of procurement, getting things into the trust, getting things distributed, staff, the fact that, for instance, junior doctors are not moving on from one place to the other, annual leave, or, I would imagine there's a million things going on behind the scenes that finance teams are going to be involved with. And I'm guessing that's what they're doing. Now, I would imagine finance teams have the same anxieties that everybody else in the population has about what's going to happen, the impact on their families, on themselves, their risks of picking up the virus, etc. And certainly they, I think, need to access all these services that anybody else is accessing in the hospital, because they're going to be affected just as much.
It's really interesting to hear about the work you've been doing to develop the services to support staff. We've obviously heard lots about getting all the equipment in and making sure that the machinery is there to deal with the pandemic, but we haven't heard so much about the work that's been going on to prepare staff for it and to maintain their resilience. So that's really interesting to hear about. Thank you. Is there anything that you would say to your finance teams or your wider management teams about things that they could do to support their clinical colleagues during this time?
Yeah, so I think the anxieties that I've picked up from clinical staff is worries about personal protective equipment, it not having enough of it, And I know everywhere nationally this is, going to be a worry concern. And I think that all the people involved with getting equipment, supplies, be they drugs or wearable consumables or patient-related equipment, that is so it's such an important part of this, because otherwise it will just amplify the clinical anxieties about, becoming infected themselves. So I think that it's a really important job. And one of the things this has already taught me, not that I didn't know it before, is that everybody in the chain, every link in the chain is important. So we've all been used to delivering healthcare for all this time, whether it's whether you're considered clinical or admin or finance or whatever it is. We all have a link to play, and if anything, this pandemic has just amplified that, brought that into much sharper focus, that we can't do without any of these links. We need all of them. And so whatever can be done by the finance team and procurement and other people to get supplies in and allay fears, it's really important. I mean, here's another example. I mean, this is maybe a more HR example, but some of our doctors and nurses, probably our doctors more, fellows who've come over who have visas that are work-related. But of course, nobody's going back to their countries after their rotation finishes because of all the travel restrictions, etc. And those same doctors are carrying on working in the UK. And if they become poorly, they're going to need the NHS. And so, but some doctors are worried, or their families, in fact, are worried that, well, how is my care going to be paid for if I'm not a British national? And so, these sort of questions for our workforce and answering them and helping to reassure people in that situation that they as the doctors or nurses and their families will be taken care of by the NHS, given how much they're sacrificing for the NHS and the risk they're putting themselves under, would be really, really, useful. And again, that might be a finance/HR related thing that we need to just, sort out. And the other thing I have to say is that I don't know how people are going to sort the finances out after all of this, and I suppose it's one of these things that we just have to worry about later. But I imagine it's like a huge landfill site where people are going to be trying to find specific things that may not easily be recognised after all of this, in terms of annual leave, paying for goods, wages, people not moving on, who pays for what, when, it's going to be a little bit of a mess. So I think we also need to think about the recovery phase where we can, and just everybody needs to pace themselves in terms of getting through the peak of this pandemic, and then thinking about pacing themselves so they have a bit of recovery personally, and then can help recover the NHS and recover how the money is moved around and where it needs to get to, and how people are reassured.
That's great, thank you. So can you tell me what you think about the leadership and the management of the current crisis?
So, what, I think this is really, really difficult. How people in leadership positions, whether you're head of an ITU, head of a department, head of a business unit, chief executive, it must, finance officer, chief finance officer, the stress and the strain on that leadership group must be just incredible, because you have information coming down from the top. You have command and control structures, so you might feel as though you have no control and you're just having to do what other people want. Essentially there is no training. I mean, everybody does disaster planning, but really this is, a once in a century type event. So I feel it must be very difficult for people who are senior leaders, middle managers of all backgrounds and disciplines, because it's unprecedented. And they are trying to be visible, they're trying to show leadership, they have to take on new pieces of information on a daily basis. They have staff dropping out left, right and centre. They can't control things like flow of PPE. Their inboxes are always full, but they're now, even more full. So I think it's a really difficult time, and I think it's important that everybody asks how everybody else is doing. So, the assumption that because somebody's normally a leader that they're not feeling it is a wrong assumption. And one of the things that we've taken up in our trust, hopefully, is asking two questions: am I okay? Are you okay? And helping people have a conversation, so that if they are worried, fearful, anxious, whatever the feeling is, they've got an opportunity to say that. It's not dependent on hierarchy or seniority. And I think everybody's got to look out for each other because of the strain at all levels of any organisation.
Sanjay, thank you so much. That's been absolutely fascinating. Thank you for spending some time talking to us and sharing your insights.
To support our members and colleagues, all COVID-19 related briefings, blogs and news articles are openly available on our website, hfma.org.uk. There is no need to be a member to access these, so please tell your colleagues. We hope to provide regular podcasts throughout the pandemic covering a range of areas. If there is a particular aspect that you would like to hear about, please let us know. The HFMA will also be providing more webinars on a range of topics to both support the immediate needs of the NHS finance community and future CPD requirements. It is important that we support each other and keep our network strong. We will do all that we can at the HFMA to enable this. If you have any suggestions of other support that we can provide, please email us at policy@hfma.org.uk. Thank you for listening to HFMA Talk. Don't forget to subscribe to this podcast to keep up to date with new episodes.